Now let's look at the next question. So here we're looking at this question where it asks you to identify the blood vessel, and then there's a secondary part to it, which is physiology. What would be the result if there was atherosclerosis in this vessel? So first, the blood vessel that you're looking at, notice this vessel here. This is the thoracic aorta. This is the thoracic region, so this is the thoracic aorta. So let's look at the choices right here. Arch of aorta, so naturally it's not this one. Abdominal aorta, no. The abdominal aorta would be way down here in the abdomen, and we saw one of the previous slides which had that. Thoracic aorta, so obviously we can think of this choice, and if it was just aorta, so possibly, let's say, so we'll keep that in mind too. Now always when you get vessels, if there's something like thoracic aorta or abdominal aorta, it's always better to write the exact identification if you know it. For example, if you know that this is thoracic aorta, write it, but if you don't know and you just write aorta, that's fine. Don't make a mistake, because if you identify this as abdominal aorta, then it becomes wrong. Okay, then it says what would be the result if there was atherosclerosis in this blood vessel. So remember, we are looking at just these two choices. These are wrong. So therefore, you should still look at these choices. If there was atherosclerosis, that means the heart rate will not increase, because atherosclerosis has nothing to do with heart rate. Heart rate won't increase. Neither would stroke volume increase, because heart rate and stroke volume, which determine cardiac output, have no relation to a blood vessel being narrowed like this. So if this is the blood vessel and there is atherosclerosis up here, it's not going to affect heart rate or stroke volume in any fashion. That is going to be affected by increased contractility, or by action of the sympathetic nervous system, or by end diastolic volume and so on. What will this do? Because the vessel is so narrow, blood will flow through it, but there will be a greater resistance. So that resistance is known as peripheral resistance. So that would increase. So wherever possible, you must always use words that you have been taught. So you know that when we are discussing blood pressure, we talk of peripheral resistance and we talk of cardiac output. So that's what happens. In old people, very often when they get old, the blood vessels harden. There may be atheromatous plaques, and they have atherosclerosis in them, and that's why they have high blood pressure. And the reason why they have high blood pressure is because the peripheral resistance increases in these people. So that is the correct answer. And then you think of this, blood would become more viscous, that means blood becomes thick. That won't happen. Just because there's a plaque and narrowing of the vessel, that has no reason to make the blood more viscous. So this again is not a choice. So therefore, this is the correct answer. Let's look at this question. So here it talks about this person who's an athlete, who's a tennis player who trains for 6 hours. So obviously daily training, so that person is an athlete. Athlete, in his case, his stroke volume is more than that of a sedentary person. So that is very true of athletes. They have higher stroke volumes. And then it asks you, what do you think his heart rate will be compared to a sedentary person? So now we know that stroke volume times heart rate is equal to cardiac output. So if someone's stroke volume is more, to maintain the cardiac output, then their heart rate will be lower. So then if this is low, this becomes high, and that maintains this cardiac output. And that is what happens in athletes. Athletes have a lower heart rate. So this is the right answer. And actually the reason for their lower heart rate is because athletes have a very active parasympathetic system. And this is what they have, what is called the high vagal tone. The vagus, which carries the parasympathetic fibers, it is very, very active. So they have a high vagal tone, and the parasympathetic nervous system decreases the heart rate. Because their heart rate is low, what happens is it allows the ventricles to relax for a longer time, so they fill with more blood. So therefore, that when they fill with more blood, the end diastolic volume is more, so they can push out more blood with every beat. So therefore, their stroke volume is higher. So because athletes have a high vagal tone, they have a lower heart rate. They compensate for this in order to maintain cardiac output. They compensate for this by having the higher stroke volume, and that's how they maintain their cardiac output. And then let's look at this question. So here it's again on cardiac cycle. It asks you what would be the effect on the heart if the close properly at the end of systole. So normally at the end of systole, the aortic valve should close because you don't want blood to come back from the, so again if we draw the heart this way, and this is the aortic valve here, and this is the aorta coming out from the left ventricle. So it should close so that you don't want blood to come back into the left ventricular chamber. So what will happen if it does not close? So blood will come back into the left ventricular chamber, and it would have more blood than normal, because blood will come back from the aorta, and in any case it's going to receive blood from the mitral valve too, from the left atrium through the mitral valve. That blood will come too. So now it's going to have more blood than normal, so the left ventricle will dilate. So therefore this is a possible choice. So the heart will not shrink, the neck veins won't get engorged, because that is to do with the right side of the heart. And, you cannot write answers like this, the body would suffer, so it's not this one. So the left ventricle would dilate. So that is right. Then it says, what would be the effect if this valve was stenosed? So now, if the aortic valve was stenosed, that means it's narrow, the left ventricle has to work really hard in order to push blood out through this valve. When it works really hard, its muscle begins to get hypertrophy. So this left ventricular chamber would hypertrophy, and that is what this answer says. So therefore, this is the right answer. So you can see how you should you need to know the cardiac cycle and how you need to work out the correct answer. This also gives you an idea how you should answer in your test, because you can't write things like body will suffer, heart has to work harder. Instead, you have to write it in proper terms, such as the left ventricle with hypertrophy, or like peripheral resistance, for example, in the previous answer, like I said, peripheral resistance will increase. So you have to use those terms. So this finishes